Hey, Joel. I'm excited to be here today for a couple of reasons. One, and Tyler may not know this, so I am a beneficiary of Adventist Health. I had a significant surgery at Lodi Memorial back in December, and before I went under with anesthesia, I was randomly asking everybody in the OR where they were from, where they got trained, where they went to school, and so on. And invariably, the answer was a local school, a local high school in many cases, and they were all working locally in the community. They had, in some cases, been there for 25, 30 years doing the work they do because they were committed to the community they were in. And I don't think in that case we're that different in a town like Lodi from a town up in the foothills. There's a commitment to community, a commitment to growing your own, and the reason we were created, HealthForce Partners, back in 2018, as a sector partnership in healthcare, was to focus on exactly that. How do we grow our own talent into filling the much needed roles in healthcare across a region that had distinct and diverse needs in just about every healthcare discipline there is. And toward that end, over the past several years, we've been building programs in alliance with our healthcare partners, which include Adventist, Dignity, Sutter, Tenet now, a number of others, as well as with our education partners across the spectrum, from graduate level university programs to undergraduate to community colleges and K-12 systems, building dual enrollment opportunities, building accelerated degree programs, and most importantly, being responsive to employer needs throughout the region and identifying what those needs are, hospital to hospital, clinic to clinic, city to city. Our region, our original region, covers San Joaquin, Stanislaus, and Merced counties. So a large footprint, not as large as the Sierra region, but certainly one that has a distinct array of different types of personalities, different types of environments, city to city and town to town. What we have found over that time is the critical importance that is placed upon building locally responsive training programs, those that involve local employers, local education partners. The thing that we've seen so often, whether it be in Stockton or Modesto or in Merced, is healthcare employers being forced to recruit from out of the area to fill needs, in many cases to provide early career experiential opportunities for employees. However, those employees tend to go back where they're from after that 1 or 2 year experience because they've got that experience under their belt. And their goal is to go back home because, after all, so many of us are committed to where we come from and want to be able to practice where we live and where our families are from. So our goal over this past 7, 8 years now has been to build locally responsive training programs that will allow us to continue to build a locally trained, locally grown workforce that serves as a retention strategy for our employers. Toward that end, I'm actually going to advance a slide, even though you can't see it, so that I know what I'm talking about today. So when we talk about our guiding principles as HealthForce Partners, we are, as a structure, a 501c3 nonprofit organization. We are now known as HealthForce Partners California because we are active in multiple regions of the state, from the East Bay to the North Bay to the Northern San Joaquin Valley. And we've had a lot of interaction with the Model of Job Training folks, California Jobs First folks here in the Sierra region, about how we can maybe give assistance to you as you look at the needs in this region and how to work together across a very, very, very large footprint and a very distinctly different type of environment from many of those that we have worked in previously to build some of the same types of opportunities for local residents that we have been able to assemble in our own areas. But our focus is threefold always. One is workforce expansion and upskilling of the current workforce so that we do build, as Tyler referenced, career pathways, not just on-ramps, not just entry-level jobs, but true pathways into a lifelong career pursuit that you don't have to leave your home area to be able to pursue. Second, building educational and career pathways that are built with local partners. In this region, of course, Columbia College, Saracoso College, and other providers at the educational level can be critical elements of an overall strategy of how we build a workforce that's rooted in community. But alongside that, bring in outside players at the graduate education levels, for example, that can augment that work. And we've certainly seen some of that in our own region. We don't have, for example, a medical Medical School in the Northern San Joaquin Valley. We are now working with 2 of them to provide locally placed residency opportunities and experiential opportunities for medical students from those schools, but also to ensure that those medical schools are recruiting from our own region with the intent of placing back into our region those practitioners when they graduate. That's part of our goal of creating an ecosystem of care where we have the ability to grow our own, retain our own, and serve our own. And third, in doing that, we build community and economic impact. The idea that we are investing in our own people, but that also lifts up our own communities, both in social standing, but also in economic vitality. And with that, I'm going to take a break. Thank you. Make it look so easy. So I'll go back to our mission as HealthForce Partners is to create sustainable solutions that drive economic mobility, expand career pathways, and strengthen the healthcare sector. And we do this through building partnerships. After all, we are in fact a partnership of all of our employers in the region, our educational partners in the region, our workforce agencies in our region. And that is true in each region that we operate. And our goal is to always be additive to the equation and to be essentially a spokesperson, a catalyst, a communications hub for the industry and education partners together. I mentioned our guiding principles. These 3 big boxes are our guiding principles as an organization. And as an organization, we are governed, in fact, by a board of directors that consists of the CEOs of the hospitals in our region, the leaders of our educational systems in our region, and as a true sector partnership, our job is to be responsive to their needs, but also to facilitate their ability to interact with each other and build the very types of partnerships that coming together that Tyler referenced as an entity in and of itself, as an intermediary, a backbone partner that can enable so much of the things that, frankly, hospitals and clinics and universities and colleges don't have the time to dedicate to full-time because it is a full-time job. So as we look at the Sierra region, and talking with Alex and James and others with front-to-load job training and in the region, we've been thinking about what the challenges are here in this region and how we can be helpful to them in this region as a collective entity, everybody in this room working together, looking forward. And so we have a little bit of a table exercise today that we want to ask you all to participate in. And we have a couple of framing questions to start with. First, how do we define the healthcare sector workforce challenge across the Sierra region? And second, how do we create a shared vision for overcoming that challenge? That's really one of the overarching goals of today's convening, is to think about this type of approach, of an overarching collective approach to solving the workforce challenges in this region. So today, at your tables, individually, we'd love for you to write down 3 words that you associate with the healthcare workforce in the Sierra region today. Each of you, individually, writing down 3 words that you associate with the healthcare workforce in this region. And if you're from the east side or the west side, you can be local, you can be full regional, you can look at your own collective experience, but also think about it from a broader perspective of the Sierra region in total. But then also write down 3 more words, 3 that you would like to see. 3 words you would like to see associated with the healthcare workforce in the Sierra region going forward. And I'm going to ask you to take a few minutes to think about that, write down those 6 words in total, 3 and 3, and then we're going to ask each table to elect a leader to come up with an outcome of that discussion, to think about it from the perspective of your collective experiences at your table. What are those overarching themes that you think about currently and in the future? So take a few minutes, if you could, to write down those words and then talk about them in your group. And I'm going to call on each table to have a spokesperson talk about those in a few minutes. And I promised Mr. Alexander he would go first, and of course, so everybody at his table just left him. Come on up.
job, but somebody's got to go first, I guess, right? So we'll see how well we interpreted the question. The words we came up with, we started off with like small and aging. But the words we actually came to agree upon was collaboration, communication, and education. And what we'd like to see happen is to share best practices, which is what I think we're going to do. We're preaching to the choir a little bit. Highlight some success stories. Find those individuals and raise them up and say, this is what can happen to you. Because the last step is to invite future candidates and people to join us and to get involved in the process.
Thank you. I'm going to ask the next table over right here. Do you have a spokesperson?
Good morning, thank you, Paul. I had the pleasure to collaborate with a great table over here, and our 3 words were access, qualifications, and turnover. And some things, oh shoot, I left my other paper over there. So some things that we would love to see is healthcare education, career education, beginning in the middle schools, starting with career days and getting a lot of that exploration going on so they can build a pathway up through high schools into their community college or UC programs, and so that they know what that pathway is. We talked about expanding services to veterans and other disadvantaged communities for behavioral health, suicide prevention, programs like that. And we talked about limited broadband access and internet access, creating limitations and access issues for people that may benefit from online healthcare services, and just navigating the healthcare system online in general is a challenge for most people, much more if you don't have good quality broadband access out in the woods. And that was pretty much the gist. Thank you.
Thank you. Now over to this table right here.
So our first was impacted. Second is disjointed or kind of siloed. The third was standard level of care, where we kind of meant by, well, what was the second set? Our words that we would like to see are collaboration among area employers and schools, in more innovation and growth, and then follow through with care, which was kind of meaning more options for patients and developing more innovative ways to deliver health care by collaborating.
Okay, I'm going to ask the party bus in the back here. This group here, who's your spokesperson?
On a different table. Very rowdy. Okay, so we came up with a lot of really good words here for the first 3, but attentive, caring and compassion, and capable are things that many are seeing with our current staff. And looking at the second regarding what we'd like to see to help those that are already engaged and doing well would be increased staffing levels. We're seeing burnout, folks being overwhelmed. And we wanted to see increases in services, more comprehensive services, which means that's even a greater load on the staff. So that staffing level is really important. And then that ties directly to housing support and availability. So that's something that we want to focus on. And then with all of that, you get career advancement. I think you get much higher employee satisfaction when they see a future. And that's going to address the public perspective of accessibility to services. And then after that, retention. So those are what we're doing.
Thank you. Let's shift a little bit this way now. Who at Matt's table wants to
Matt doesn't want to do it.
Send the grant evaluator who's taking notes. We talked a lot about collaboration, lack of access, and barriers, both in terms of housing affordability and also barriers to educational pathways. And then things that we'd like to see, certainly affordability, increased collaboration, and what's the third?
More local programs.
More local programs.
Hello, everyone. Our table talked about increasing providers, livelihood, and interdependency. And things that we would like to see is increased collaboration, connectedness, and cohesiveness.
Perfect. Thank you. I hope we're picking up. There's a few themes that are starting to emerge here, and that was kind of the goal here. We'll talk about that in a minute, but let's go to this table right here.
Our table's 3 words were limitations or limited opportunity, the passion of the workforce, and then also being overburdened. And what we would like to see is increased opportunity for increased compensation, the expansion of opportunities, be that training, education, upskilling, etc., and also an increased diversity.
I'm going to come back to the center table here.
So our table said community-oriented, lack of capacity, and opportunities. And I think opportunities is that we've already seen what it's like to work together. We've already seen that we can do things with the innovative people and partnerships that we have. And then what we want to see is homegrown, keeping our own, sustainability, so not losing our talent, and also increasing our funding, and nimble adaptability to stay with the current times.
So what we hear, I think, across the spectrum here is with some very key points brought up about veterans care, about broadband access, some other individual elements that are really, really, really important pieces of the puzzle. But broader term, I think we're hearing about some shared vision of what some of the challenges are right now, but also how invested everybody is in what they do in healthcare in this region, which is so, so critical, of course. The other thing I think I'm hearing, at least, is opportunity. There's an opportunity for cohesiveness, for collaboration, for building together something much grander than what might currently be in place, because it is, as was brought up a couple of times, maybe somewhat fragmented. You have geographic limitations, you have resource limitations in this region. Those are the kinds of things that require collaboration to overcome. And we've seen some success models out there when that does happen. I think Sarah Coastal College, with some of the programs they have launched, very innovative programs they have launched recently, are a great example of what's possible when employers and education partners come together around a common vision of what is needed and what they can accomplish by working together. And today I wanted to preview for you, at least, how that might look in this region if it was to come together in such a way that this, literally today, could be a springboard for. And that is what we call a next generation sector partnerships approach. And when I say that, that sounds like a bunch of big words, but there actually is an awful lot of substance behind it. It's an industry-led, community-supported partnership across a region that strengthens the economy and connects people to jobs, and not just to jobs, but to careers. And the listing here I put on the board is a number of the defining characteristics of what a sector partnership approach might look like. When we talk about a sector partnership, we're talking about an industry sector, in this case, healthcare. And the defining characteristics include operating in a regional labor market region,
led by and continually attracting influential, engaged private sector leaders, for example, your hospital leaders, your clinic leaders, focusing on an industry-identified set of solutions with economic impact at the core, as well as, of course, just meeting the needs of industry. It's supported by a coordinated team of public partners across a region. That would include workforce agencies, that would include other public agencies, behavioral health departments, health services agencies, and so on. It operates under a shared up-to-date action plan. That action plan is reviewed on a regular basis by the collective group across a region in gatherings just like this one, where there is a plan that has been enacted, it's been agreed upon by the collective group, and then in the next go-round, a year from now it might be, you come back and analyze where you're at with that plan. What are the successes? What are the failures? What are the challenges that have yet to be met? Somebody mentioned earlier about successes and celebrating those successes as case studies of what's possible. And I couldn't agree with that more, because we all learn from those. But in addition, a sector partnership, generally speaking, is organized for the long haul. It's sustainable over a number of years, not simply over an episodic time period. For example, much of the grant funding that we see in this region and in other regions of the state right now, whether it be from the California Jobs First Initiative or from the state's K-16 initiative, are dollars that are temporary. They expire next year, September or December of next year. That's not sustainable for the long haul if that's the only work that's being done. Our job together collectively is to view those as pilot projects, as seed investments to build something much more sustainable. And our hope today is, in talking with my friends at Buffalo Job Training, that this is the start of that sustainability effort. The goal of bringing this entire sector together, a cross-cutting collaborative that includes healthcare, it includes education, it includes workforce, to organize for the long haul, and ultimately to achieve meaningful results that benefit the region, benefit the populations in the region, benefit the communities in the region, and provide greater access to care because there are more locally trained care providers there to provide it. So what is the role of a sector partnership? There are three primary roles, I would argue: convener, collaborator, and catalyst for the things that we want to attack. One, as a convener, a sector partnership can bring leaders together across sectors. As a private entity, in our case, for example, we're a nonprofit that is governed by the very leaders that we try to convene. So the ability to bring them together to collaborate on challenges that are shared across systems, shared across public and private, for-profit and nonprofit, agencies and employers and education partners, but then to be able to navigate around and through those challenges as a more nimble intermediary that can do things, frankly, that a lot of bureaucracies have challenges with. That's one of the benefits of having that sector-based approach. It's not incumbent on any one partner to achieve the goal. It's incumbent on the partnership to work together to enact those goals. Second, as a collaborator, and that was one of the words I heard multiple times here a few minutes ago, our job as a sector partnership is to build relationships and engage partners across the region, to collaborate on initiatives and funding opportunities to attract new resources into the region. Not just subdividing the pie that you already have, but rather growing that pie by attracting new resources to bear, but also, importantly, by enabling and enacting programs and initiatives that grow the workforce in the region. And in doing that, as a catalyst, we do advocate for those changes that were talked about here today. We work together as a collective region to attract resources that are more sustainable in nature, that are, in some cases, pilot programs that can be grown into sustainable entities. And in doing that, you start to create the infrastructure for sustainable change, and you start to realize the vision that was talked about in many of your comments just a few minutes ago. But importantly, as a sector partnership, I think it's really, really critical, especially in such a huge footprint that the Sierra region represents, that there be a regional focus, but also the ability to focus locally. East side, west side, county by county, city by city, rural area by rural area, entity by entity, on what some of those collaborative opportunities look like, but also what some of the individual opportunities and challenges are, so that they can be acknowledged and worked upon together. Because by working together,
we improve everybody's outcomes. So our job as a sector partnership is to enact local level programmatic opportunities while focusing on regional initiatives and priorities. And in doing that, we build those local bridges to meaningful careers in healthcare for local residents. We build the educational pathways that lead them to those opportunities, but we also build the resources that invest in the very creation of those opportunities to begin with. We have case studies that show this has worked in other areas, in our own work in our region. The HOPE program for nursing is one example, an accelerated degree program in nursing, which guarantees an 17-month actually, degree in nursing for incumbent workers from 4 local hospitals that are collaborating together in a particular region to provide their own staff with upskilling into nursing roles. It's a tremendous retention strategy, it's a tremendous upskilling career pathway strategy for employers, but it's also an investment in the economic vitality of the people in those communities, and it's diversifying the nursing workforce to reflect those that they serve. In this program now expanding to a second county, we now have 6 employers involved across 2 counties. We have 2 colleges involved, and we have a real investment in the growth of the nursing workforce from our own healthcare providers, upskilling medical assistants and nurse assistants and phlebotomists and others into becoming registered nurses. And with an articulation agreement we recently signed with a CSU campus, now there's a pathway to become a bachelor's degree in nursing candidate as well. These are the types of programs that happen when a region comes together and collaborates. Multiple employers sitting together, working with education partners and an intermediary to invest in creating solutions to shared problems, shared challenges, and frankly shared goals of how we can create a better future for our own communities. You can see a quote here, which I won't go into reading entirely, but one of the founders of the program, who was the chief nursing officer of one of our hospital partners at the time, has published on this very program. We've seen the results of it be adopted in other parts of the state, and we're very excited about the fact that this is an example of what can happen when employers work together and bring education to the table and tackle a challenge that's shared among them. Similarly, we've done work in the behavioral health space, working on the Behavioral Health Workforce Partnership across now 3 counties, where we are taking a similar path of upskilling current workforce, of investing in retention bonuses for those in the workforce. Burnout was mentioned many times here, certainly coming out of the pandemic. The burnout of behavioral health professionals has been very tangible, very real. And one of the ways that we work to stabilize the workforce is by providing student loan repayments, by providing retention bonuses, but also by upskilling others in the behavioral health sphere into graduate clinician roles, and by facilitating a growth of the pathways into those roles by creating greater opportunity for clinical experience in our region, so that our local residents have the ability to gain the experience they need at our local universities and with local employer partners that ultimately, after clinicals are done, become their employers. So they're building their own future workforce by sponsoring more interns. And the only way that's come together is by having an intermediary nonprofit that has been able to build out that network for them. As you know, of course, strengthening the behavioral health workforce is essential to expanding access to care. Same is true of nursing, same is true of allied health, same is true of first responders, same is certainly true of physicians. And in our region, and in the other regions we're working in, we're also very invested in serving our local communities by ensuring equity, ensuring opportunities for a diverse workforce that reflects the communities it serves. And we've built a number of programs that invest in that very effort, including a healthcare professions pathways program funded by the state. This was funded by the state as the result of a collective approach across several employers in multiple counties, banding together with our masthead and approaching the state with an opportunity to invest in a program that will reach local residents where they are, reach those that don't have access to traditional pathways into education and into healthcare, picking them up and giving them directed opportunities, giving them financial supports, giving them mentoring, giving them things that are as basic as a basic life skills course,
so that they have the preparation to enter into those entry-level roles. You see an anecdotal story here of one of our recent graduates who now is starting her healthcare career as a CNA at one of our local hospitals. And similarly, we're investing in some of the work at the high school level, working with a collaborative of students across a particular region, in this case the city of Modesto, to enhance CTE pathways, to develop a career pathways guide for all students in that district, and to promote education and career exploration beyond just becoming a nurse or a doctor, but learning about all the wide diversity of healthcare roles that exist. Again, these are things that happen when we are able to bring together employers and education partners to work on a shared vision for how we can change the trajectory of people's lives in a community. And toward that end, one of the things that's most important, I believe, is to have data that reflects what the needs are in a region. And we've been working for the past year or so on what we call a healthcare capacity hub that will be a data source, a portal that our employers and our education partners can have access to, that provides them with real-time or closely equivalent data on what the needs are in industry, role by role, employer by employer, county by county, alongside what the capacity of that region is in terms of the educational programs that currently exist, and where the gaps are. How do we need to invest in certain programs to expand them, in other programs to create them, so that we can bring resources to bear to tackle the exact roadblocks to a broader healthcare pathway. And toward that end, this project is now launching in a 3-county region in Northern San Joaquin Valley. We're working on a similar approach now in the East Bay, in the Contra Costa, Tri-Valley, Diablo Valley region, with a number of employers in that region. And the next step will be in the Napa-Solano region. So these are transportable technology solutions, transportable survey opportunities, and we're working with some of the partners represented here in this room even on some of this, which is certainly an opportunity in each region that we are aligned with. So my question today is, what would a sector of partnership approach for the Sierra region look like? And these are questions for all of you to consider and to think about and to discuss hopefully as you go through the rest of the program today, and we think about the future of this gathering today, as we think about what that gathering might look like a year from now, and we think about all the work that can occur in the meantime, in the next 12 months. How do we ensure that rural, tribal, and underserved populations are at the center of our workforce solutions for healthcare? How do we ensure that commitment to equity across the region? What are we uniquely positioned to pilot in this region that other regions might not have the ability to do? For example, what are the unique aspects of rural healthcare that lead to opportunities for pilot programs in this region that may not be as relevant in San Francisco or Los Angeles? I would wager there are quite a number. And what makes this moment the right moment for action? I touched on that. I don't think it's a matter of if the region is ready. I think it's an imperative that the region has to be ready. Because of some of those funding opportunities I mentioned that are temporal in nature, that expire next year, the changing, shifting landscape with Prop 1 and with Medicare, the changing aspect of what FQHCs are able to do and tribal communities need to wrestle with, but also the challenges that rural hospitals face. The moment is right because it's imperative that everybody work together to tackle these challenges. And so the questions for the region: what would a collaborative, community-rooted solution look like? And who must be at the table? And how would it function? And my hope is that today we can think about that collectively. All of you can think about that individually as well. And that there can be, at the end of the day, some thoughts about what the next steps would look like for the Sierra region. Who needs to be at the table? What are the employers that should be in any conversation around these topics? So that there can be a collective, industry-led approach as a sector, as opposed to one-offs, but as a sector, to tackling some of these challenges and really to involving our education partners across the region in growing programs to serve their constituent base. So next steps, questions, who will lead? Employer partners, again, who are the employers that need to be at the table? Who will collaborate alongside the employers, the education, labor, and other local and regional partners? Who would convene and manage the day-to-day work? Who is that intermediary or backbone organization that can be that glue, that day-to-day oversight of that effort. Who would fund this initiative? My argument would be that it needs to be a graded approach so that there is sustainability across the enterprise, but also across multiple programs, so that a nursing program can continue even if funding goes away for a medical assistant program, and vice versa. Who would benefit? In my estimation, everybody benefits. Employers benefit, workforce agencies benefit, local residents benefit, communities benefit by greater access to care, by care from a locally grown workforce. And with that, I hope these are questions that you'll think about today. I know that the rest of the program here that Alex and James have put together is going to touch on some of these topics, among others. And I hope this just sets a stage for you for things to think about as a region, an approach that can be enacted together, collectively, because there's greater power in the whole than there ever is in the parts. And my contact information is here if anybody has questions about what we do, how we do it. Happy to be of service anytime. I will point out, I'm a part-time Amarillo County resident, so I have roots in your region. It's now our region together, and in the coming months I'll be a full-time resident. So I look forward to working with all of you and actually benefiting from this work when I have to get my neck surgery, which hopefully I won't, but I'm just saying. But thank you for your attention today. I hope you had some fun at the tables with the tough conversation, but also I hope you saw that so many of the topics that were brought up are shared among different entities in this room that are represented, and from people from diverse backgrounds, from places, from organizations. Let's bring you all together and work on these challenges together, because that's how you move this discussion forward. Question?
Yeah. Paul, do you have a website where people could access FAQs in the healthcare industry? In other words, if I went to a website that you developed and asked about an existing, what we used to call the Candy Striper program, why that's not enacted now to bring in high school students that could learn the most basic levels, which empowers them to believe that they go on, in, like they did in the 60s, to Samuel Merritt Hospital, Nursing Hospital in Oakland. Is that model back? Is it not happening? What would be your best answer?
My mom was a candy striper, so I love that analogy. But we can connect you with the proper resources in any case, and I encourage you to visit our website. Contact us directly via email or phone, and in every single case, whenever there's a question, we connect you with either the right source or we provide that information directly. It just depends on what the topic is. In this case, I would point you to some of our hospital partners and get direct answers on that.
I'd be happy to give you a direct answer.
Thank you very much, and I look forward to interacting with you the rest of the day.